Feline stomatitis is probably the most frustrating of all the diseases that we deal with in cats, just because we do get a considerable amount of pain with those patients, and we do get a certain amount of refractory cases even after we've done full mouth extractions. About 80%, 70 to 80% of the cats that have full mouth extractions for stomatitis respond and need no further care after 3 months or so. Some in 30 days will look fantastic. Some will take up to 3 months before the sutures dissolve, the inflammatory process goes down, and they do resolve at that point. But if it's beyond 3 months and they still have considerable inflammation, those are what we deem as refractory cases, and something else needs to be done to them in almost all cases. Now, there are cats that have inflammation that is close to the inflammation that you see here after extraction, but they don't show any pain on a pain evaluation. In other words, we can get those cats in, we can open their mouths, we can actually touch the tissue, and they don't respond. We can also get the other end of the spectrum where we don't have a lot of inflammation. We do that same pain evaluation, and as soon as we try to open their mouths, they scream and try to get off the table. So you can't go based on inflammation alone to determine further therapy for these, although most of them are still painful. So this is traditionally what we see. We've got profound inflammation present in at least the caudal portion of the oral cavity. We don't necessarily have to have extension rostrally. The main determining factor is back here. If you see that caudal mucositis, that's stomatitis. Doesn't matter how severe or how lack of severity you see in the rest of the arcades. If it's got that, it's definitely gingivostomatitis, and the only predictable means of therapy is either caudal mouth extractions or more widely recommended by specialists, full mouth extractions. We do have some that will respond to caudal mouth extractions if we don't have the changes that we see here in the rostral part of the oral cavity. So that is a possibility. If you don't have any changes here, there's no tooth resorption, there's no periodontal disease associated with the canines or incisors, all this is perfectly normal, but you have problems back here and you have the caudal mucositis, then you could potentially do caudal to the canine extractions, and some of those will resolve 100%. And we used to do that. In my practice, we used to do that very approach where nothing rostral is abnormal, let's try the caudal first, and a lot of those would resolve. We don't know why, because we can get a root tip that's left from a full mouth extraction and cause severe changes. You extract the root tip and the whole mouth resolves. So there's a lot of things that we don't understand about this disease. We definitely don't know what causes it. We do know that there have been correlations with some of the 8 infectious agents that cats get, Bartonella being one of them. We know for sure that that's not involved. There's no correlation. There's actually some studies that show a negative correlation with Bartonella and stomatitis, so you don't have to worry about that. Herpes, there doesn't appear to be a correlation, although the studies are not definitive. There is some conflicting evidence between studies with herpes virus. But you can always have any of those diseases can exist concurrently with stomatitis. So if you have symptoms of any other entity and you've diagnosed that, then certainly you could have active disease, and so you'd want to treat that separately and treat the stomatitis separately. But they're not going to that agent is not going to cause what we're seeing here specifically as a causative agent. So treating that disease is not going to lessen the severity significantly of the stomatitis. The one thing that we do know is that if we have a documented herpes virus infection, lysine will help decrease the severity of that and consequently make these cats feel better because they feel better in general. So this is a product that's available that cats, believe it or not, even with stomatitis, will find pretty palatable. And so we would recommend, if they do have concurrent herpes virus, to use lysine to help decrease the severity of that. Khaleesi virus, on the other hand, does have a high correlation with feline stomatitis. It is not, again, a causative agent, but the studies show that it's present in all cats with caudal mucositis. And Philippe Hennet in France has done the majority of the work with khaleesi virus and stomatitis, and the studies that he has done has been on actual virus isolation and not PCR, so they're pretty convincing. That being said, we know that a lot of the recurrent cases, the refractory cases, when we treat to decrease the severity of the khaleesi, we get sometimes full resolution of the residual stomatitis, and we'll talk about that shortly.